how do we think going forward about epigenetics and equity?
Thank you for the question. I don't necessarily think that any of the principles, issues, or potential solutions differ, quite frankly. I think if we're talking about a research, in the research domain, which I would imagine that's what you're thinking about from CIHR's perspective, again, if we're trying to capture all of those intersectionality and those impacts and how they imprint, if you will, to use a pun, on those kinds of outcomes, we need to reflect that kind of diversity in the participants or the samples that we're using to make those characteristics and those associations. But again, you know, research and clinical care, as everyone probably appreciates, is inextricably linked, and the opportunities to participate in research trickle down to those people that are often in our medical hallways. And the people that are then recruited into clinical research usually, unfortunately, again, represent a small segment of the population. So again, I go back to the thesis from the top. I don't think that we can achieve that kind of diversity in our research until we also think about the diversity in our clinical hallways as well, and make sure that we do the best that we can to recruit and engender that kind of trust and meaningful engagement from broad segments of our communities that represent the kind of intersectional differences that you're reflecting or the research project's reflecting.
Mm-hmm. But to add on this, so I think I really appreciate the question, because when we speak, so I'm population geneticist, so I have this bias of thinking of ancestry, descent, etc. But more and more, and the National Academy of Science in the US really ask researcher and recommend to collect not only all these data on self-reported ethnicity, self-reported, well, country of birth, etc., but also collect environmental data, because we need to have it hand in hand, both the genetics and the environment, to be able to act and do precision medicine. And I think that for me, one of the way forward is to use these wearables. And actually, we have a small pilot project on one rare disease where we want to implement it, but that allows us to get much more information on nutrition, etc. And if we're able to have some sort of representative sample, we may be able actually to capture some individual in some groups that are underserved and capture really all the environmental effects that are true social determinants of health as well. Yes. Thank you.
Hi, so I'm going to be a bit provocative. Wendy Unger, I'm here, I'm based at SickKids. I'd like you each to comment on how you see the risk of precision medicine actually exacerbating inequities. So I already know racialized, marginalized communities are not well engaged with the healthcare system. We introduce technology, highly complex technology like genome sequencing. It's concentrated in urban centers, usually teaching research centers. People are already not accessing the healthcare system, and now you're bringing in these types of technologies and hopefully using them more in clinical medicine. Even some genetic testing technologies are becoming quite routinized. So I'm wondering, I'd like to hear from you, to what extent you think rapid evolution of these technologies and introduction of them may actually exacerbate existing inequities in the population.
So I'm turning.
Maybe I can. You know, it's a very valid question, and I think it's depending on kind of technologies. For sure, there's definitely that risk, and we talked about that just in terms of precision therapies. But let me give, you know, if I take the example though of something like smart wearables, I mean, they're getting really good. You can get a lot of data from them, and a lot of home monitoring that can go on now, and where you can keep patients out of hospital, and at the same time, you're kind of tailoring their care, especially when they're in the remote communities, to how, when you see those early warning signals, for example, heart failure, and you can change their care at home to prevent it from getting exacerbated. That, I think, is an example where you're democratizing the access to healthcare for people in remote communities while personalizing it at the same time. But I do agree that when we talk about things like the omics and the next generation and third and fourth generation that come along, it's more complicated. I don't really have an answer to that at this stage because we're still doing it a lot in the research realm.
Yeah, I mean, I just wanted to, sometimes it's not just the technology, but the way we roll the technology, in the sense that I'm thinking, for example, of genetic counseling, which is a very, very important, sort of profession. And, this use of this technology, you need individuals who are knowledgeable, who can provide psychosocial care, that they're going to be able to help the patients with their diagnostics. But we only have close to 400 genetic counselors in the country, not a lot. And this means that probably the big provinces will have between 30 to 70, genetic counselors for the whole province. And some provinces, maybe have one or two. So you can imagine, I mean, if the idea is these are going to be precision tools that are going to be useful, but at the same time, you don't have enough support. And that might, sort of tip the balance into something that's maybe a little bit more inequitable.
I'll just add, I don't know if you're going to go next. This keeps me up at night. You hit the nail on the head. When I go and again, privileged enough to go to different lower resource settings, and we wield the new digital health app or the new fancy test technologies, and the reflection is we don't have genetic counselors, we don't have this test. We have to travel from various different parts of the same country to one center, and those centers don't even have the right expertise to actually interpret the bioinformatics. I mean, part of me just feels like I've just come from a different planet, and what am I doing here? But the other part of me also reflects on the fact that, again, we have to think about what we provide in an ecosystem. And so, when I think about the digital health platforms, that I think about bridging ways of increasing access, regardless of geography or background, and making what otherwise is a low, limited resource like genetic counselors more accessible, for example, or more understandable and from different cultural perspectives. But at the same time, that could actually exacerbate if people don't have broadband access, don't have Wi-Fi, the way that I try to square that circle is to think about not only high-tech solutions, but also couple them with low-tech solutions. So again, just to use the digital example, thinking about kiosks, thinking about public library access, thinking about interpreters, thinking about, again, and this is classic health services and implementation science questions of when you roll something out, figure out what the barriers and solutions could be to complement that strategy, whether we're talking about high-tech genomic testing or other kinds of technologies. That's sort of the basic principle. And I worry about, and the flip side of that question is when we also start to work to meaningfully engage and partner with communities, I think us as a community have to be open, if we want to be partnering, to hearing that they don't care about the latest and greatest shiny widget that we have, and they just need access to basic clean water or a family physician. And as researchers, I'm not a clinician, I'm a researcher, I have to think about what is my obligation to hear and try to address the global questions that they're raising that might not be my research priorities, but I have to be okay with that if this is going to be a meaningful partnership, that we're thinking about priorities and strategies on both sides of the table.
Roberto Mendoza from Clinical and Metabolic Genetics. It's somewhat of a follow-up question to that, because you mentioned genetic counselors, and genetic counselors get mentioned a lot. And I agree their importance, but geneticists also, as interpreters and orderers of those services. And Yvonne, you mentioned us being a funnel in the system because family physician has to eventually refer. What is the role of CIHR and of researchers in engaging more people and in raising awareness about this human health resource deficiency? We are deficient in that we only train 7 geneticists per year in Canada. And there's no stimuli to increase the size of those cohorts. We actually have to fight for an additional spot for the university. How do we overcome this? And the second question is, how do we empower youth in diverse populations so that they become the physicians, that then they implement this? Don't we need to do more work at that level, at high school, and interesting them in this science and in making them part of the healthcare system?
I'll just start maybe. Last week, I was invited to be a mentor for a group of high school women, people from grade 6 to grade 11, to try to light a fire, ignite the possibility of STEM, of science, technology, engineering, medicine, and talk about the challenges and be real about like getting to this top echelon that we're talking about and really it was a community of individuals that are minoritized and racialized and of mentors that come from the same background. I was one of the few people that were not of that background, but it's about, and it's the best practices that we hear about in other domains as well, is that people want to see like people. So whether it's on the front lines as clinicians, that they engender that trust and that comfort and relational space and safety, or it's people in academics or elsewhere that they need to see those people at the top, that they can be to see themselves there as well. And I don't mean top in a hierarchical sense, and I don't want to create those kinds of hierarchies when I speak in that way, but that's one example. And Roberto, I don't think you're going to love this response to your first question, but I think that we need to train more MD geneticists and genetic counselors, but we also need to realize that genetics is going mainstream, and that's for the benefit of precision and personalized medicine. And we need to figure out ways that that can be implemented at the front lines by the specialists that don't have the specialty training that you all do, that can still make meaningful interpretations, because they are ordering these genetic tests at the front lines and they are interpreting and actioning those results, often without the training expertise and resources that you all do. And we have to be thinking about models of care in order to mainstream genetics as well. So it's sort of a top-down approach, and we have to be thinking about buddy systems, triage systems, digital systems, whatever. But I think that if we want this profession to grow, if we want to see the meaningful realization of precision medicine, it has to go across all medicine as well as training the specialists.
And maybe we don't want to say this out loud, but the whole AI counseling that is happening for mental health, when there is a deficiency of mental health researchers. So we may not want to replace ourselves with AI, but we may have to, when there's a shortage, to have in somewhat, full responsibility for all of it. But I think that's where it's headed when there's such a shortage.
I'm just going to, quickly, for me, if we can do this appropriately, then, we can allow the geneticist, if we're rolling in this digital technology and AI, at least allow the geneticist to be able to focus on, rather than necessarily being behind that computer when they're talking to their patient, that they were really able to free up time. It's not necessarily a question of replacement, but hopefully better management, of the process, whether having to go through hundreds of records that could be done by something else. And then you would get the information so that it'll help you. But I just wanted to, I was asked to advise for an emerging economy about their precision health, kind of role in the country. And I was asked for some reason to talk about ethics and law, but anyways. But the other one was training and education. And one of the great things that was built in that country was they created a DNA museum for all ages. So children, as young as 3-4 years old, would be able to go into the museum and be able to see what, genetics and genomics was about. Curriculum in the schools included some information about that. And there was a mentorship program that was also, created that allowed, because usually in that country, but maybe other countries, you would ask the question, you say, what do you want to be? Like, I want to be an engineer. I want to be a pilot. I want to be a doctor. What kind of doctor? Have you thought about genetics? Have you thought about, geneticist as in a PhD geneticist? And that opened those doors. And, it hasn't been many, many years. So we're hopefully going to be able to report on the success of this. But already the number of visitors, the number of students that have been democratized to some extent to this is really important. And I think we can do that. We can start with that.
Mm-hmm. Well, I cannot agree more with training and all of this. I think in STEM in general, so as a woman from a rural background, you can imagine that the barriers were large to go to university and further go to professorship. But I think that the more we teach genetics early on, and the more we teach it in a way that people are interested about it also, and STEMs in general in schools of all socio-demographic background, that would be ideal. But that needs a big political will, and we will probably need to push at the political level, I think, for that to occur.
There's one question online now, and there's a couple from before. We've touched on some of them. There was a question about developments in gene editing. I think probably have to ask them, but I want to read the one that just came in. Oh yeah. Despite the existence of policies, initiatives by governments, institutions, etc., the playing field in genomic data sharing seems to benefit the wealthier nations, primarily in the West. Yet advancement of science and medicine requires data from low middle income countries. While data sharing is encouraged, researchers from lower resource settings can be deterred from engaging in data sharing if they may not obtain benefits of data sharing. How do we ensure benefits of research go beyond national borders more equitably?
Well, I mean, I think that was what we were discussing in terms of this power dynamic that exists sometimes, that you have unfair partnerships. All the data comes from one place, but that place doesn't get anything in return, no attribution. Publications are published, they're acknowledged perhaps, they're not incentivized or empowered. But that has, slowly, hopefully started to change in terms of the standards that are being set. I mean, there are very important projects that have created wonderful policies when it comes to data sharing, facilitate this, interrelation or this interaction with multiple jurisdictions without having one side, power dynamic tip for others. That requires proper attribution, that requires empowerment, that requires understanding what benefit sharing means for that community as well. Because we always have this idea that benefit sharing is, one size fits all, but it's actually different depending on where you are and depending on the community that you're working with. So there has been hopefully some advances, but not fast enough and not big enough. And I think we need a lot of work to get there. But hopefully by setting standards that are that take into account this reality, I think is a really good and important step, acknowledging that it exists and working on making it better. Because otherwise what you'll have is the full reaction, which is data does not leave. Our data stays here, right? And this move by certain countries to block the sharing or transferring data from that country to anywhere else, which has unfortunately the disadvantage of not being integrated within larger data sets and therefore making more diverse data sets. So you want to ensure that that not happen. But if you want to do that, you want to make sure that there is proper attribution and proper empowerment.
If I might, we're just going to add that in today's day and age, you don't even have to physically transfer data anymore, but you do need the ability of whether it's the institutions or the governments to allow data sharing to occur in a cloud where it's still regulated, it's still controlled and owned by whoever posted it, but it allows for data sharing to occur. But despite the technology being available, those platforms being available, there are systemic barriers to being able to do that even today. Like we have a lot of international research, and we still struggle between Europe and ourselves to kind of do that data sharing, because some institution loves their data in the cloud, another institution doesn't. And I think that does have to change.
Anyone else? Okay, so we have to wrap up. I think it's important that we continue to amplify and celebrate success, and to allow our champions to provide examples that we can then share with others. I think open science kind of gives us a guide towards doing this, right? When we see success, we need to share it. We need to teach others how to do the things so that we can overcome some of these barriers, as opposed to in silos, but together as a community. I'd like to thank our panelists today for your wonderful contributions. I love how different your perspectives were, and it really made for a rich dialogue. So thank you all for being here. And thank you for CGEn and CIHR for putting this together. Oh, sorry. I called back up.
No, I just wanted to thank everybody for coming and for your time, and hopefully it was a useful conversation for all of you. Thank you to the panel, Ian, to you, and all four of you for giving your time to this important topic. We have some food coming. Please hang around, network, talk to our experts. And as a way of thank you, we have a little token of appreciation for the panel members as well, which Halit will hand over in a minute. So thanks again for coming. And this was the first Café Scientifique, hoping to do more of these in the future as well. Thank you so much.